Welcome back again, everyone. And to those of you just joining us, thank you and welcome to Texas Biomed's first virtual Global Health Symposium, celebrating the 80th anniversary year of the Institute. It is my distinct honor and privilege to be sharing the virtual stage with this morning's guest. Barbara Pierce-Bush is a fellow at Schmidt Futures, a venture facility and foundation for public benefit focused on technology and society, shared prosperity, and scientific benefit. In this role, she supports racial justice, global health, and COVID-19 investments and programs, along with some of the world's most talented entrepreneurs through the Entrepreneur in Residence program. Barbara is also co-founder and board chair of Global Health Corps, an organization which mobilizes global community of young leaders to build a movement for health equity. Global Health Corps has placed over 1,000 young leaders on the front lines of health equity in Burundi, Uganda, Tanzania, Malawi, Rwanda, Zambia, and the United States, developing a cadre of creative, effective, and compassionate changemakers. In 2017, Barbara released Sisters First, a New York Times bestseller written with her twin sister and co-author, Jenna Hager. In 2019, the two released the children's book version of Sisters First, also a #1 New York Times bestseller. Congratulations, Barbara. Barbara received her undergraduate degree from Yale University and her master's from Harvard University. We are thrilled to have her join us today. I know you all are joining me as I welcome Barbara to our virtual symposium. Barbara, thank you so much for being with us this morning. I'm delighted to be speaking with you today and to have you share your insights with our global audience.
Thanks so much, Dr. Schlesinger. I'm thrilled to be with you all this morning. First of all, a big happy 80th anniversary to Texas Biomed. What a great way to celebrate in a year, I guess, in the past year that really shows why your work is so critical. Thank you for including me.
Barbara, terrific. Let's do a little bit of question and answer here, Barbara. So I understand you recently became a fellow at Schmidt Futures. Can you tell us a little bit about the work that you're doing there?
Absolutely. I started working with Schmidt Futures, which is a newer foundation focused on addressing the world's biggest problems, in July of this past year. So I am like one of those many people that started working virtually. I have not met my team in person, but what I was charged with was to work on global health and racial justice. And I had been offered this position in December of 2019. Of course, at that time, we didn't realize how important global health was going to be. I knew it was important just because this is how I've spent my time, but we didn't realize how important it was going to be for the world with COVID. And so since I joined Schmidt Futures, I've been lucky to work on a number of initiatives. The first thing I got to work on was a large research project that we co-hosted with the National Science Foundation and then a number of researchers at Cornell and Harvard and Columbia. And what we were trying to do with that was study 23 different countries' responses to COVID, to identify why some did a great job and others didn't. And of course, this narrative is still going on. This research is still going on. At the time, we thought that this would be a few month long research project. And flash forward, of course, the world is still dealing with COVID. And what we found, not surprisingly, is it's quite intuitive. Countries were able to deal with COVID not necessarily because of their public health expertise. Yes, that matters. And of course, everyone that's on this symposium and their experience with that matters. But the countries that did really well were able to focus on important things like trust and culture. And of course, we saw this in the United States. And so what we've been calling it a country's pre-existing conditions. If they were able to address their pre-existing conditions in advance of an emergency like COVID, they could see a very different future. And that looked like things like trust in government. It looked like, of course, in the United States, we saw how COVID, unfortunately, because we had polarization pre-COVID, took advantage of that. So all of a sudden, people are questioning whether we should wear masks and are masks a political statement, et cetera. So focusing on pre-existing conditions in a country matters. Focusing on building trust by demonstrating that you're trustworthy matters. And lastly, cultures of solidarity were able to do a better job. So locations where people were more used to acting in concert versus cultures of independence were able to address COVID in a different way. And of course, everything we learned has twisted and turned as time has gone by. But I think these lessons have been really interesting as we think about what does this mean moving forward. These notions that can be considered soft and less important, like trust and culture, actually are so critical when we face a challenge like COVID. And so I love now thinking about what does this mean from a policy standpoint? And what does this mean from a science standpoint when we think about the value of science, but if we don't have the value of trust, doesn't matter in the same way. Is it effective as it can be? And so how can we build off of these learnings to make sure that when we think about what's coming next, we're ready in a different way?
A quick natural follow-up to that, it's so important what you've said is that where the next outbreak occurs, where it starts, has a big impact on how it evolves. Is that what you're telling us?
Absolutely.
Yeah.
That is what I'm saying. And of course, none of us know where that will be, but we know it will happen, unfortunately.
Absolutely.
And it's up to us now to make sure that we're prepared for that. And of course, that has to do with science, and it has to do with policy, and it has to do with ways that we approach community and trust. And so I'm loving now at least knowing this knowledge, because then we can act on it.
Super. Barbara, you're working in areas that some people may consider not related to each other, racial justice and global health, for example. But these issues are in fact interconnected, as you've already told us in responding to the first question. How do you focus your energy in these areas? And how do you avoid becoming overwhelmed by the magnitude of change that can happen in so many different areas? How do we begin to think about this?
That is a great question. Well, I think the two things that probably motivate me the most are problem solving and doing. I'm a doer. I like doing rather than I get too much anxiety thinking about not doing things. And I never intended to work in racial justice, actually. I was interested in global health since I was 21 years old. That was, what I was going to do. And as I worked in global health for the past 15 years, the work that I was able to be part of in the United States is what led me to get an interest and become, more obsessed with thinking about racial justice. And that's because through Global Health Corps, the work we did in the United States was in Newark, New York, Boston, and DC. So primarily global health issues that affect urban areas. And of course, what we were finding is the work that we were doing, if we looked at health outcomes, it was minority communities that were having the worst health outcomes. And it wasn't, of course, because they were taking worse care of themselves in any way. It was because we had disinvested in those communities. And so as I was working from a health standpoint, I realized I can't be as effective as I want to be unless I also understand the racial justice implications. And so I actually went back to grad school last year. I was probably one of the oldest grad school students ever, so that I could study racial justice policy as it related to global health. And then, of course, as we saw in this past year with COVID, of course, racial minorities were disproportionately impacted by COVID. And again, it's not because people were taking different precautions or worse precautions for themselves. It was because of the systems that we have in the United States and structures and communities and how we serve people. And so I now see such a direct link between the two. And I know you've really demonstrated this in your career, but we have to be interdisciplinary when we think about solving problems. You can't solve a problem in a silo without considering the other social aspects that affect it. And so now it's almost like I can't see how they're not related, and therefore it's solving one big problem together.
It's so true. And I hope one of the major takeaways from this symposium is having people that normally don't talk together to really understand that interconnectedness, just in the way you've said it now, Barbara. I really appreciate that. I'm going to change slightly here in my next question to you. You've obviously led a very public life. We've seen you since you were young, and one in which your parents, particularly President Bush, has played such an important role in global health issues, especially in Africa, something that I always remember, and when he started PEPFAR and the programs in treating young children with HIV. What is it about global health issues in particular that you find so much passion in, and your family, how has the family influenced you in thinking about global health growing up?
Great question. Tremendously. I have been tremendously influenced by my family to pursue global health. And the reason for that is that I've had a very unusual life. And when I was in college is when my dad was president. And my parents were incredibly generous and that they let my sister and me know that we could travel with them whenever we wanted, obviously, as long as we took care of school and took care of our other responsibilities. And that type of exposure completely changed my worldview and what I thought was possible in the world. And so, for instance, when I was 21 years old, at the time I was an architecture major, and I had a summer internship and I was able to take 2 weeks off of it to travel with my parents for the launch of PEPFAR, the President's Emergency Plan for AIDS Relief, for those on here that don't know what that stands for, which is a huge US policy that is now responsible for keeping 20 million people alive around the world with antiretroviral drugs. But at the time, and this is almost shocking when you think about it, because it wasn't that long ago, it was 2003. If you were living on the continent of Africa, you could not get access to the drugs that you needed to live. It was estimated that 40,000 people had access to antiretroviral drugs. And, we knew that the need was multi-million. And so this was going to provide and does provide free drugs for those living with AIDS. And I was lucky to go on this trip. And it's, of course, totally cliche to say that travel changed my life, but travel did change my life. And I was shocked when we landed in Uganda and there were hundreds of people waiting in the street for drugs that any of us could have gotten in the United States. Any of us could have walked to our local pharmacy and gotten antiretroviral drugs. And I'm obviously very idealistic in the notion that, where you are born dictates what your life can look like was totally unacceptable to me. And what was incredible, though, was that on this trip, I met community activists, I met doctors, I met nurses, I met policymakers who were stepping up to change this and saying it's absolutely inappropriate that people can, in some places, AIDS can be a chronic illness for them, and in other places, it's a death sentence for no control of their own. And so this trip completely changed the way that I thought about problem solving, and that we actually can solve these problems, and that doing so in community really matters. And I went back to school and I dropped my architecture degree and I took every global health class I could. And then, of course, you think now, flash forward almost 20 years later, how many millions of people are alive because of this? And it's because we have these incredible tools like drugs and information. And if we can figure out how to use them to serve people, then the world can look completely different. And the world looks completely different because of this. And so I obviously became obsessed with global health issues and then couldn't figure out why I would want to work anywhere else but on these types of issues. And I know the same is for you in your career.
Oh, it's absolutely so true. I love your story about your first trips internationally. I remember early in my career, my first trip, since I studied tuberculosis as a career, my first trip to India was just a game changer in my thinking about global health issues and delivery and the interconnectedness issues. So I really can appreciate that. Barbara, I've been a physician scientist for more than 30 years now. And now I lead an infectious disease research institute where we really want to change the world in a proactive fashion, knowing these issues are going to continue. And one constant I found is the need to always educate people about the interconnectedness of global health, the exact topic that you and I are talking about today. When we say global health, we really do mean it. I know you know this. What happens in Nigeria or Japan impacts us in San Antonio, in Atlanta, Dallas, Paris, London. What has surprised you most about people who assume or simply don't know about global health and what it means?
Mm-hmm. Great question. So I think there's two things that surprised me. One is that we have global health issues in the United States. And I think people often are surprised when I say I work in global health, and some of that work is in the United States. And of course, we're part of the globe. And you were saying what happens here affects other places and vice versa. And then two is how critical different skills are in approaching global health. So I'd love to share a little bit about Global Health Corps and kind of highlight this more. So I founded an organization called Global Health Corps with several co-founders now about 11 years ago. And the reason that we started, we weren't intending to start a nonprofit. We were all obsessed with working in global health and figured, we would figure out how to do it ourselves. And what happened was at the time, Peter Piot was the head of UNAIDS. And he was hosting an AIDS conference for young leaders and called AIDS 2031. And he was about to retire from UNAIDS. And so he brought these young leaders together and he essentially said, what is your generation going to do? What is my retirement plan? And he was concerned because so many of the leaders in global health started as doctors or nurses in the 80s and 90s, treating people with this unknown illness, that now we know as AIDS. And they then ended up, rising through the system and ending up leading these institutions across incredibly influential institutions around the world to focus on both AIDS, but now more broadly, the field of global health. And he was concerned that with this group of people retiring, were we going to keep making the same progress and build off of the momentum that we've made? And so he posed this challenge to us, and we ended up starting an organization called Global Health Corps, which is specifically about training the next generation of global health leaders. It is a leadership development program, and we recruit young leaders from around the world who join us for a year. They are embedded within ministries of health or other service delivery organizations where every single day they're working on solving the gray area challenges that exist in global health. And then they go through our curriculum, which is focused on policy change and advocacy and entrepreneurship. So they have the systems change skills they need to be effective throughout their lives. And they're all 30 and under, which of course seemed old until I aged out and my co-founders aged out. And we realized that maybe we shouldn't have been so stringent about that. But the reason for that is we're trying to grab great talent at the beginning of their career and focus it on solving problems. And what has been so interesting, and I don't think this will surprise you, but this surprised us at the beginning, is when we meet with our partner organizations and say, what are your biggest needs? What are the skill sets that you, if you had on your team, could really help you make a bigger impact? They now rarely request doctors or nurses. They're requesting systems thinkers and they're requesting system skill sets. And obviously doctors and nurses are critical. But what they want to do, of course, is make sure they can reach people before they get so sick that they ever need to see a doctor. And this has opened up the field of global health to so many different young leaders that never would have seen themselves in this. And so, for example, I know you've spent your career working on tuberculosis. We have now worked with 20 Rwandan architects. Our fellows are from around the world. It's this global group of young leaders that's, critical to us that they're global, because as they move through their careers, they need to be speaking through each other across borders and across organizations. But anyway, 20 have been architects, and they've specifically worked on tuberculosis. And what they have done is worked with the Ministry of Health in Rwanda and a great organization called MASS, where they've redesigned the way that air flows throughout health clinics in very inexpensive ways with fans and with sunlight, et cetera, so that infectious disease doesn't spread at the same rate. And it's been incredibly fascinating to study, to compare and to study health centers that have these changes and health centers that don't, and see how airborne illness drops dramatically. And so people aren't heading to a health center because they're sick with one thing and leading with something else. And of course, this is specifically, the reason for this was initially focused on tuberculosis, since it's airborne. And now we've seen these different ways to address a problem that you've worked on for your life. And these fellows, now that they've completed their fellowship, will continue to work on for their lives, but they'll use a different lens. And both lenses are so critical. And so that's something that I think people are surprised often when thinking about global health. They think, I'm not a doctor, I'm not a nurse, therefore I don't have a role to play. And actually, we know that's so different. That's so not true, that we really need every skill set thinking about these problems so we can continue to get new solutions.
I love that story because, and I think this environmental smoke also plays such a critical role in human health, something we also need to tackle as well. As a quick follow-up for that one, though, what do you think are some of the challenges then? When you interact with these young talented individuals who are game-changing environments and finding new solutions, but there probably are still some challenges. What do you think are some of the challenges we face?
Absolutely. There are tons of challenges. We wouldn't exist if there weren't, unfortunately. I think, so when we screen our fellows, we look for a number of leadership characteristics, and commitment to serving others is number one. Making sure that we're connecting to other people and we're not building systems in a silo, not building systems without thinking about how people interact with them. Thinking about behavioral science. And we've seen that with COVID. How do you get people to change their behaviors with masks, with social distancing, et cetera? And we are complicated. Human beings are incredibly complicated. And so we need to really understand, we don't know why we behave the way that we behave. We just do. And understanding why humans behave the way they do is so critical when we're thinking about health interventions. Something can look so great on paper, and then you roll it out and people behave completely differently. So the connection with people is something we screen on. And then something else that we really look for, not surprisingly, is commitment and resilience. When we are talking about health systems, it almost, a fellow actually said this. He said, it's like working towards the light at the end of the tunnel, knowing you may never see the end of the tunnel. It is long work. It is hard work. It can be not particularly glamorous. And a bad day in global health, as we've seen this past year, can mean horrible, can mean loss, can mean grief, can mean seeing human suffering. And it's so important that we don't get numb to that. Obviously, we all need to do our best to be able to show up as our best, but we can't be complacent. And I think this year has really shown us that we can't be complacent. So those are two things that I think are so important when we think about how we approach problem solving, that we continue to really think about humans at the center of what we're doing and make sure that we are there to serve them and make their life better every single day. Therefore, our interventions will be more effective.
I love your comment about getting numb from this. Historically, we haven't done very well. I mean, if we look at history, it would say in the next couple of years, and we will do better and better with COVID-19, but there will be the next one. And, will we have forgotten? Will we have lost this energy and understanding of just how much a global infectious disease threat can shut down society? Is it going to be different this time, Barbara? Do you think these young leaders are going to make it different for us? Or are we going to be back not prepared again?
I hope so. I certainly hope so. I'm optimistic. Clearly, I'm sure everyone on this call is. I think you have to be optimistic to work in global health. If you're a pessimist, this is not the field for you. But we've heard for years, of course, that there could be a pandemic and there would be a pandemic. This is not anything that we haven't heard. And yet we forgot that it could actually happen and how brutal it could be. And so I hope each of us will use these memories to think about that. And I think that there are a few things working to our advantage. One that you mentioned is the global nature and the interconnected nature of the world that we live in. And I hope that we will, we know that we have to think, we can't be isolationist when we think about global health. And so when I look at our fellows, obviously when we work with them, we're in it for the long game. We're in it for their careers. We want to know what they're going to be doing in 20 years, because that is scale to us, how they will serve throughout their lives. And we saw this, actually, I can share this about Ebola, when we've now worked with about almost 1,500 young leaders. Again, they're from around the world. And when the Ebola crisis broke out in West Africa, what we saw is that our alums quickly moved from Malawi and Rwanda in the United States to Liberia and Sierra Leone to open the Partners in Health office to work for the Ministry of Health. And what they did, it was like where one Global Health Corps alum went, 7 Global Health Corps alums went. They called everyone they knew in the network that had supply chain management skills, that had procurement skills, and said, I am here. We are looking for these types of skills. Will you come? And it was incredible to see how many, we probably ended up having 50 alums. We do not have programs in West Africa, working in West Africa with each other and from around the world, from probably 7 citizenships. And I hope that we continue to see that as we move forward, because that's what we're interested in. We have this alum named Adana Chukwuma, who's Nigerian. And actually, she served her fellowship in Newark, New Jersey. And your question before about the interconnectedness of the world reminded me of her. She, in New Jersey, worked with the mayor's office to roll out a community health worker program. New Jersey's healthcare system was very, very taxed by people that were seeking care at the emergency room, which is incredibly expensive. And there were ways to keep people healthier to where they never needed to reach the emergency room. And so the mayor's office was specifically focused on this. And Adana grew up in Nigeria, where there's a shortage of doctors. So the healthcare system is largely run by community health workers. And she imported best practices from that model to Newark, where they enrolled trusted community members who would visit these patients who were the most high-risk patients, accompany them to doctor's appointments, make sure they had the medicines they needed. I mean, they would go so far as to make sure that they had food to take with medicines, and if they didn't, accompany them through the food stamp program. And this was all, normal to Adana. This is what she had grown up with, but it was new in Newark. But Adana raised her hand at Global Health Corps training when we bring all of our fellows together. And she said, it's going to be so convenient when I am the Minister of Health in Nigeria, and Solene is the Minister of Health in Rwanda, and Diego is running the Gates Foundation, because we're all going to know each other. We're all going to have a shared vision of what health equity looks like, and we're really going to get work done. And obviously I burst into tears and was totally inspired by that. And then Adana completed her fellowship, and she returned to get her PhD from Harvard, being paid for by the Ministry of Health in Nigeria, with the stipulation that she returned to work for them. And so we are seeing that. But I think that global mindset and that notion that we can't do this alone, and that we need to draw on different skills and different people, is what will set us up to succeed the next time there is a pandemic.
I love that. That's terrific. There was an article published several months ago in the New York Times about the silent killers that are going on today. And it was a story about how with COVID-19, we've redirected a good chunk of public health infrastructure to COVID-19, but yet the number of cases of TB, HIV, and malaria continue. They're not going away. And so what is life going to be if we've not had enough infrastructure support? But what you're saying to me is maybe we'll be more nimble to pivot with multicultural, aspects of training and execution. We'll be able to pivot more easily. Do you think so? Because I feel like we need to still grow infrastructure.
I think we absolutely do. And I have been worried to read those articles that you're alluding to. I've been worried to learn about how, women, maternal health is suffering during this. We saw that with Ebola, of course, that when Ebola happened, maternal health suffered tremendously. We know that that's going to be the case now. And yet I think for anyone that's not interested in global health, they have had to become interested in it over the past year. And for my friends that normally, when I talk about working in global health and their eyes glaze over, they now get why this matters. And so I do hope that we will become more nimble, but also that we have demonstrated in the past year why this matters from an investment standpoint and from an infrastructure standpoint, not just for COVID, but for every other health issue that we know is related, since they're all related, since we're, one human body.
Yeah. So important. Ebola's, I'm very proud of Texas Biomed's involvement with Ebola for a very long time. In our containment facilities, we've been studying vaccines and therapies for Ebola, and some of what we have worked on in the so-called preclinical space is actually being used now in the DRC, and now, as you know, a new outbreak in Western Africa of Ebola. So these things keep emerging, and our scientists have played a critical role with Ebola, as well as with COVID-19. So this symposium, Barbara, is bringing together thought leaders in science, public policy, and global health. Again, we no longer should think about them as disparate, but rather absolutely critical to think together. In your work in public policy and global health, what would you like to see from scientists, or what more can scientists do to help further the cause of equitable, available public health worldwide? What should we be thinking about?
Great question. Well, first of all, I couldn't be more grateful for scientists. I think, this past year has really showed that. And even with seeing the vaccine development so quickly, what an incredible, years of incredible work going into this. I think when thinking about policy, I keep coming back to this notion of trust and how critical trust is, and how we have to demonstrate that we're trustworthy in advance. We can't, unfortunately, when the emergency strikes, try to get trust then. It really needs to be years of demonstrating that we're trustworthy. And I think about that when it comes to science, because when we think about how to use science to serve others, we haven't had to think about how to get people to trust in it before. And I think that that's the long, hard work there's not a clear answer. There's a lot of gray area, but demonstrating that it's trustworthy now is going to be so important before another outbreak happens. And I wish I had a great way to say how we should do this. But I think it's something that all scientists need to think about. And I think it's something that policymakers need to think about too. It's something that seems like a nice to have, but is so critical. And it certainly worries me seeing a lack of trust in science, seeing a lack of trust in medicine, seeing a lack of trust in doctors. But we know this is something that we're going to have to face. And so we can get to work in demonstrating trustworthiness through and through in everything that we do.
Yeah, we're challenged by just the 24-hour news cycle and the misinformation that's being rammed down our throats. I think the public is very aware and engaged, which almost creates a further challenge because they're reading everything they can read on their phone. So education becomes quite important here, doesn't it, Barbara?
Absolutely. Education becomes important. I think trusted messengers become important. And that's something that I think we learned a lot about this past year. Unfortunately, in the United States, we have less trust in institutions. But that's why, for instance, Dr. Fauci was so powerful, because he was an individual rather than if you were hearing from the government. And so I think it's really important when we think about education, who are the educators? Who should the educators be? Who should the messengers be? And we've been working quite a bit on vaccine hesitancy at Schmidt Futures with this incredible organization called Made to Save. And actually, the way that they're approaching it is they are working with organizations that, from the sort of civic space, that work to enroll people in this census, work to get people who were concerned about taking the census to fill it out, et cetera. And they worked with these community messengers, community members who are active civic participants to do this. And they are now working with those same people to focus on addressing vaccine hesitancy, to focus on answering questions and concerns about vaccines, and actually listening to what the questions and concerns are. And I say this because we wouldn't think of these people as global health workers or public health workers, but they are deeply trusted. And they are also very, very willing to listen and say, what are your concerns? Not, I know better than you, this is how you need to be treating this, but what are your concerns? Let's talk about it. Those are real concerns. Concern for your family, concern for your children are real. Let's also talk about vaccines. And I think when we think about education, we need to be thinking about the two-way street that's required, the listening that's required to understand what people are worried about or what misinformation they've heard. And then who do we want them to be hearing from that could better educate them or could better relate and identify with their experiences so that they might make different decisions?
So there are many of us in our areas of science, and what you're suggesting, and I agree with this, is that regardless of what our career choice is as scientists, there's opportunities to be dropped into some of these global networks that you're talking about, almost like a bureau, not a speaker's bureau, but a Q&A bureau.
Yes.
To try to get ahead of the misinformation by having more penetrating forces at the field level in the communities on talking about the facts rather than the fiction, right? This is what you're suggesting? Absolutely.
I mean, there's been already a number of just open Q&As with scientists, with doctors, with people that worked on the vaccine. I'm sure you've seen Dr. Kizzmekia-Corbett, who I know actually later today or maybe tomorrow in your program, you'll have people that worked on the Pfizer vaccine. And the more that people that are worried or not worried, just interested, can pose questions to them and hear directly from other human beings who have families, who are taking care of their own health, but who also have worked on these different initiatives, the more we break down those barriers that exist that lead to, we know that isolation leads to misinformation spread. We know that when you are feeling isolated from other information or isolated with who you're talking to, you're more likely, unfortunately, to grab onto conspiracy theories or grab onto misinformation, which is why this past year was very, set us up, unfortunately, to be very dominated by misinformation.
Absolutely.
But the more that there can be the two-way street of talking and listening and responding to people's concerns, we know that is effective. That has been demonstrated to be effective, and we're seeing that with the vaccine right now.
Yeah, I've known Dr. Fauci for decades as a longstanding NIH-funded investigator, and having worked on council. I tell you what, just knowing who he is, and at 80 years old, The difference he's making in the world and the choice he's making and making sure that facts get out there is incredible. This is a man totally dedicated his entire career to ensuring that there's public health that results from all these infectious disease threats that we face. Yes, we'll be hearing a lot more about Pfizer to this broad audience, Barbara. The little known secret is that the preclinical space where we work in, early on, we developed and validated our animal models for COVID-19, and we're able to, in a close partnership, work with Pfizer on all those studies, those critical studies in the pipeline that enable for those clinical trials to occur. Sometimes a sensitive topic in terms of the way we interact with the animals. But you know, at Texas Biomed, we have 150 people dedicated to the humane treatment. And the animals have played such a critical role in enabling us to answer critical questions about the vaccines that are going in our arm today. Mm-hmm. So even that is an interconnectedness I like to talk about for us. Well, you know, everyone has either time, talent, or treasure to give up for something in their life. If they're motivated by the conversation you and I are having today or can spread the word to others. If you could encourage anyone to do one thing to impact public health, regardless of what their walk in life is, what do you think that would be, or what would you like to suggest it be?
I love that question. I think, first of all, the fact if anyone is on this Zoom, I'm assuming they're already giving something to global health, or they wouldn't otherwise be interested in this conversation and in this, you know, in this 2-day symposium. But I think what I would encourage everyone to do is figure out what your role can be outside of what you do day to day. And what I mean by that is we're in this moment where people are interested in global health and interested in public health, but they may not understand it. And you know, this goes to exactly what we were speaking about. Scientists hold a very distinct viewpoint of global health, where they are deeply, deeply involved in the research and data that the general public is not. So I would encourage each person here to talk to others, really talk to others about why you do what you do, what motivates you, so that you can bring other people into this space with us. We know we need more people. And of course, obviously, since I've devoted my career to thinking about this new generation of leaders for global health, I'd love everyone here to consider how you can make space for young leaders, you know, whether that's mentorship, whether that's thinking of opportunities. My mentors in global health have been incredible, incredible leaders who, when we were just starting Global Health Corps, I was 26 years old. Mark Dyball is one who would be invited to speak at conferences, and he'd say, I'll speak, but only if I can bring my friend Barbara. And that type of exposure can completely change someone's career. And I'd encourage you to think about, are there young leaders that you know that are interested in this, that exposure can open up different ways that they can serve. And you know, you're also mentoring them and showing them why this field really matters.
That's so critical. I view training, education, and research as so intricately linked. My own career has been so committed to training the next generation. Texas Biomed's future, in fact, is, and the way I envision it, is to build an incredible and unparalleled environment of research to precisely be the environment where young people can come and learn. And so we need to create those environments, right, for young people to be able to interact with a number of different individuals in public policy, in the field side of the equation, or R&D, this kind of thing. Just we have to create those opportunities, don't we?
Absolutely. Absolutely. And we can. And I think that, especially since I know how important the interdisciplinary nature is to you, can you create opportunities where policymakers are working on projects with scientists, with public health experts, with you know, whatever the skill sets might be, so that it becomes normal for us to work across the disciplines that we're used to.
Yeah, absolutely. Absolutely. And in that context, a word we haven't used a lot of is collaboration. Mm-hmm. I assume, based on this entire conversation, that we all need to view ourselves as a global collaborative community. Is that the way you would be thinking about it?
Absolutely. Absolutely. We don't need to do this work alone, and we shouldn't do this work alone.
Barbara, is there something we haven't covered in terms of your own experiences or career, or some message that we haven't gotten to? And we have about, I don't know, 500 or 600 people listening to you today from around the world, some late at night, some early in the morning, some having their coffee, some having their dinner. Is there any message that you'd like to leave us with today as we wrap up here?
I'm really, my message is one of gratitude. I'm so grateful for the work that you do. I'm grateful for everyone that's joined us, the work that they do, and for showing up. This global health is hard work. And this year has been taxing on everyone for so many reasons. And to work in this space is an honor because you get to serve other people, but you also have to show up and deal with all the unknowns that this space poses. And so I just have tremendous gratitude for everyone that has chosen this as their vocation and their purpose, and to serve others when we think about dignity and healthcare. So thank you.
Well, thank you, Barbara, for spending time with us this morning and giving us your insights. Let me personally, because this is a unique opportunity for me to look directly at you and say, you and your family making such a difference in the world. I personally appreciate it. I specifically, as infectious disease specialist, appreciate the efforts in HIV care have made such a difference and continue to make such a difference in the world. I could not have asked for a better way to kick off Science, Policy, and Global Health Symposium than to have this little chat with you. I want to thank all of you for watching this Q&A discussion with Barbara Pierce-Bush. And at this time, I'm going to turn it over to the moderator to share a few questions. Thank you very much, Barbara.
Thank you.